shared. We shared. All right, good evening to everyone, and welcome to our live today. It's 2nd of November. It's 2nd of November 2023, Thursday at 11 minutes past 19 hours. So welcome to our live today, and as usual, we are going to be only answering questions from you people. No topic I'm typically discussing. It's you to ask your questions and then we answer. And this time around, we have 1 hour, and that 1 hour will be the full hour, 30 minutes. The first 30 minutes we shall be on both YouTube and TikTok, and then the rest of the 30 minutes we shall only be on YouTube. So right away, let me begin with the first person. The first one asking a question is called Juliet Kakoza. You're saying, Doctor, is it possible to have pregnancy with uterine fibroids? And if not, what can I do? Now, this question I think rotates several times. Many times people ask about this question, whether you can conceive, whether you can get pregnant if you have a fibroid. I think this is two-way. There are people who are not able to conceive because they have fibroids, though there are those that can conceive with fibroids. Who are those people that can conceive with fibroids? Those people who have fibroids that are still small, if the fibroid is still small in size, okay? A small fibroid can allow someone to conceive. Two, if they are not multiple. There are people you find that they have multiple fibroids. Someone has around 5 fibroids in the uterus. That one, it will be hard, or it will be very difficult for that person to conceive. But if you find someone with only 1 fibroid or 2 fibroids, then that person can conceive, can get pregnant. So the issue is, we look at the size and then the quantity. How many fibroids do you have? If you have a few fibroids, 1, 2 fibroids, sometimes you can conceive. And if the fibroid is small, you find the fibroid is just 2 centimeters, 1 to 2 centimeters, and so on, those people can conceive. And thirdly, there are people who have fibroids, but the fibroid doesn't affect, okay, the hormones, the fertility hormones, except especially the progesterone and estrogen. Like you find that someone has fibroids, but those hormones are not the fertility hormones, the hormones responsible for making someone pregnant. That like they are not so much affected. They are not so low. They are not too low. They are not too high. And those people will end up conceiving because their fibroids have not affected the fertility hormones. People who fail to conceive because of fibroids are those who have fibroids that have affected the fertility hormones, and also the size. If the size is big and it is obstructing the passage of the sperms and also obstructing or stopping implantation from occurring, those people will fail to conceive. I think this question is very clear to everyone, especially Juliet Kakoza, who has asked that question. Then we go to another person. He's saying, Emma Kagesha on YouTube. You're saying, Dr. Natumia Depo in my first time. So millionaire. Sorry, Emma Kagesha, I do not speak Kiswahili, and your question is in Kiswahili. I don't speak Kiswahili. Try to put your question in English, and I don't want to use a translator because I may get it wrong. So ask your question in Kiswahili. In English, I don't speak Kiswahili. The only mode of communication on all my channels is English. I only use English on my channels, not any other language. Don't ask in French, don't ask in Kiswahili, or any other language, even the local languages, do not ask because I will not reply you. So, Emma Kagesh, repeat your question in English. Then we have Takola Kibi Barbara is saying, I'm in class, all right. Brenda Kabombeka is saying, good evening, doctor. Please make a video on a blighted ovum, the causes and prevention and its relationship to fertility. Brenda, Kabombeka. I have that video concerning brightened ovum. Check it. When this live ends, check in my videos. It's one of the first videos I made. I think I made it in 2021. So check that video about a brightened ovum. And on the thumbnail of that video, the picture which is showing on that video is saying, the baby, I'm pregnant but no baby in the womb. You check that video. It's there about a brightened ovum or an embryonic pregnancy. I have it. It well explains everything. So please, you can check it, no problem. You'll get the answer. So then Olubukola Grace, you're saying, doctor, what can someone use to treat high prolactin? All right, high prolactin, I think I've discussed, I've also had a video about high levels of prolactin. If you want to treat high levels of prolactin, use bromocriptine, right? So Olubukola Grace, number one, use a medicine called bromocriptine. Bromocriptine will be taking 2.5 milligrams daily until your hormones stabilize. That is medicine number one. If bromocriptine doesn't work, use a medicine called cabergoline. So I would recommend two medicines, though there are many medicines. I would recommend cabergoline and bromocriptine. Let me have someone online. Oh, he's gone. All right, so I would recommend bromocriptine and cabergoline. Those are the only medicines I would recommend for someone who has high levels of prolactin. I think that is very, very clear. Josephine Hambele, good evening. Doctor, good evening to you. Okling Moses, hello, you all right? Becky Brandzinger is saying, doctor, please, is it possible to get pregnant while on family planning, the pills method? Yes, it is possible. By the way, let me tell you how people get pregnant even when they are on family planning. Number one, improper usage of these pills. Usually we tell you that take that pill in the same time. What do I mean by the same time of the day? If you decide to take the pill at night at 10 p.m., take the pill at 10 p.m. I mean the contraceptive pills, the ones we call COCs, combined oral contraceptive pills. If you decide to take if you decide to use that as your method of family planning, take that pill every day. Do not skip a day. That is number one. Number two, take it on that particular time. If you're taking it at 10 p.m., take the pill at 10 p.m. If you're taking it in the morning, take it in the morning. The problem comes when you interchange. Today you're taking it at 10 p.m., the other day you're taking it in the morning, the other day you're taking it during afternoon, and so on. That can expose you all, that can put you at a risk of conceiving even when you're using that family planning method called the pills. Number two, some of you take expired pills, okay? Some of you take expired pills, and this also becomes a problem to some of our drug stores. You find that a drug is expired, but still the drug store is selling or is putting that drug on market. So if a drug is expired, then you're at risk of conceiving when you're taking that drug. Three, some people who are in immunocompromised situations. What do I mean by immunocompromised situations? You find someone is having HIV and is on ARVs. So if someone is on HIV, is having HIV, and most are also on ARVs, or even when they are just HIV positive, they are immunocompromised, or they have, those are the people we call ISS, immunosuppressed. So because these people are immunally suppressed, the medicine may not work properly, and therefore these people end up getting pregnant even when they are taking their medicines clearly. So that is how someone can conceive even when they are using family planning methods, like the pills we've talked about. Then another one, you're saying, oh, this question is running away. This question is running away. Okay. Hope Emobonivi. This name. Hope Emobonivi. Hope Emobonivi. Where are you? Which country are you? Let us know where you are and which country you're watching this live from. But you're asking your question. You're saying, my doctor asked me to take Clomid on my 5th cycle. My period was last September 24th, and my period started today on 2nd November. So what is your question? I don't get your question. Okay. This one is saying, erecting vero. Please, doctor, what makes someone to feel pain after urinating? Wow, this is a very serious question. It's a very, very serious question. What makes someone feel pain after urination? Most times it's as a result of the urinary tract infections that have resulted into what we call cystitis. What cystitis is the inflammation of the bladder. Okay? The bladder is a sac. Okay? A bladder is the sac that keeps your urine. A bladder is the sac that keeps your urine. If it's inflamed, if it's infected by probably the infections, or it has received any trauma, so it gets inflamed, you end up having pain when you're doing susu. Then that is the commonest cause, and I think that's what you need to know. Another one is saying, Elizabeth Martini. Hello doctor, I want to know what is the appropriate time for one to conceive after a miscarriage, and how do cysts be prevented? Can they affect or cause miscarriage? No, let's first look at the appropriate time when to conceive. I think check on one of my videos. I've put up a video there talking about how you can or when to conceive after a miscarriage. That video is there. For more details, check in my videos. But to give you a hint on that, I said that, number one, first investigate what caused your miscarriage. That is the advice I gave in that video. First investigate, first find out what really caused this miscarriage. Okay? You had a miscarriage. What caused it? Do tests to identify what caused that miscarriage. That is number one. Number two, first allow at least one menstrual cycle. Okay? First allow you to have one normal menstrual cycle. When you at least see periods once, then you can plan on conceiving. But however, theories or many studies have said that someone can conceive as early as 2 weeks. You can conceive as early as immediately, okay? There is no problem about that. My only advice is that if you conceive again, you may end up having, if you conceive again, you may end up having that miscarriage again, okay? So it is better to first find out what caused the other miscarriage, then you get medication for it, and then you prevent the preceding miscarriages. Then 3 is to also allow at least one menstrual cycle. Why do I say so? Because if you don't allow one menstrual cycle to pass, and you conceive again, if you have a miscarriage, if you get a miscarriage, you may not know if you start bleeding, you may not know whether this bleeding is as a result of the retained products of conception. I mean that maybe you had a miscarriage the other time and you've not yet healed. You may confuse it with another miscarriage happening. So that's why I'm saying it's always better to first, okay? It's always better to first allow at least one menstrual cycle to pass and then you conceive. Another question, okay, doctor, my medicine for fibroids, please. Medicines for fibroids. Medicine for fibroids, we have the 2 types of medicines we give for fibroids. Number one is injections, okay? You can can use injections. There is an injection called subcutaneous glycerin. Subcutaneous glycerin, that medicine can be used to treat fibroids. Number 2, the medicine called leuprolide. Leuprolide can also be used to treat fibroids or leiomyomas. And the other option would be a surgery. Now, you have to discuss with your doctor to look at the size, many parameters they look at to decide whether to go for medical or to go for the surgical measures. Why am I having negative and positive pregnancy tests? What do you mean by having negative and positive pregnancy tests? You can't have a negative and a positive pregnancy test at a go. That means there is a problem. Number one, either there is an error in doing this test. 2, this test, maybe the strips you're using have an issue, okay? If maybe they are expired, or you're not using the right technique. Otherwise, you can't have both negative and positive pregnancy tests. Then this one is saying Claire Danes Chamanywa. Wow, Claire Danes Chamanywa. Where are you watching from, Claire Danes Chamanywa? Saying, doctor, why is it that my cycle always changes? Like I can have them a doctor, why is it that my cycle always changes? Like I can have them a very first of the month. Oh, this question. first of the month, or in between when the month is ending? Doc, I have a problem. I'm not getting your question here, but I think you're talking about irregular menses. Irregular menses can be caused as a result of a fertility hormonal imbalance, okay? Especially if you have a problem with your progesterone. People who have low levels of progesterone, or what we call hypoprogesteronemia, those people can end up having irregular menses. Diseases like fibroids, okay, can cause irregular menses. Diseases like cervicitis, diseases like cervical cancer, and so on can cause irregular menstruation. So you need to do investigations around that to identify what is causing your miscarriage. Emilia Saga is saying, Doctor, I menstruated on the 19th of October. When is my ovulation date? Emilia Saga, we cannot tell you your ovulation date when we don't know the length of your menstrual cycle, okay? We need to understand the length of your menstrual cycle in order to, that if we know the length of your menstrual cycle, that is when we can tell you your ovulation day. Okay, so Emma Kagesh is saying, okay, doctor, I am using Depo. I'm using Depo for the first time. I received my periods once. All right. Yes, Nufiyu Esigi, how are you and where are you calling from? Straight away to your question. Tell us your name, where you're calling from, and your question.
Hello, doctor.
Yes, Nufiyu. We are going to lose you. You're not speaking. Maybe you have a poor internet connection. So we are taking you off. Let's have someone else.
My name is Nafi Usman. I'm calling from Nigeria.
You're calling from Nigeria. How are the Nigerians? Okay.
Hello, doctor. My name is Nafi Usman. I'm calling from Nigeria.
Please go on with your question and be very fast. We are time bound. Go on with your question. Be very fast.
My question is that, is it true that masturbation is causing?
You're saying, is it true that masturbation is causing what? I'm not getting the question. I understood masturbation, but I'm not getting what you're meaning. Is it true that masturbation is causing what? Please clarify. All right, we've lost that one. Let's read our questions. All right, Carol Kwezi, how are you and where are you calling from? Be very loud and faster.
Hello.
How are you?
Yes, good evening.
Good evening to where are you calling from?
I'm calling from Kagadi.
Yes, what's your problem?
I have my left tube first blow, my left fallopian tube first up, and the other right one is facing down, and they are blocked. So I'm worried. I don't know what is wrong. Affect conceived.
All right, now how old are you?
I'm 37 now.
Have you ever given birth?
Yes, I have 4 girls.
From-
With CS.
Okay, what's the age of the last child?
My last girl is 5 years.
All right, so what you can do, those tubes can be unblocked. There are several methods of unblocking tubes. There is the laparoscopy, There is the cannulation method, there is open surgery. All those methods can be used to unblock tubes. So you shouldn't lose hope. There is a chance of you conceiving even when your tubes are blocked. It's a matter of going to the hospital and then those tubes get unblocked using several methods. Those methods can be discussed between you and the doctor. After having a chat, a one-on-one chat, you can decide on which method to use and then you unblock the tubes.
Yes, doctor, but my left fallopian tube, one is facing up.
Don't
know what is it.
Don't mind
problem with it?
Don't mind about that. That can still be dealt with. The main issue is unblocking the tube.
Okay, doctor. I thought I was a bit scared. I thought maybe the way I've tried, I'm not on any concentrative pill. I'm just there. It's now a year so far. So I was just worried, thinking that maybe both tubes are supposed to be facing down.
So the issue is that you're supposed to unblock the tubes, and that's all. Thank you so much for checking on us. I think we should say bye-bye to you and have another person.
Bye-bye, doctor. Thank you so much. God bless you.
All right, bless you too. All right, so let's go for this question. Doctor, why is it that my cycle changes like, okay, I've answered that. Emma Kagesh, you're saying, okay, doctor, I'm using Depo for the first time. I received my periods. Please, Carol, can you mute yourself? Just mute yourself. There is some noise. Okay, all right. Emma Kagesh, you're saying, okay, doctor, I'm using Depo for the first time. I received my periods, but since up to date, I have not received my October periods. But now I have on and off period pain. I might be safe. I'm worried. Now, first of all, if you're using Depo is a hormonal method of family planning, okay? These hormonal methods of family planning can make someone to miss periods, which we call amenorrhea. So that is possible if for a hormonal method like Depo, like emergency pills, like an implant, they can cause amenorrhea. They can make someone not to conceive. So that is very possible, and it's as a result of the Depo. What you're supposed to do is to first, don't even take any medicine, just leave. First spend some month. After 3 months, the Depo will have, because Depo works for 3 months, but sometimes wearing off or wearing out from the body can take even 6 months. So there is no problem. That is as a result of Depo which you're using. Caesar Ibrahim, good evening, doctor. Thanks a lot for the discussion. Welcome. Nango Bishamim, good evening. Everyone is just saying. All right. Josephine Hambere is saying, doctor, what happened when you have a pain from both of the ovary? Pain, of course, you may not know that. You see, you may not know that you have pain in the ovaries, but what you may know is that you have pain in the pelvic region, in the maybe on the left or the right side of your groin. So that is likely to be number one, PID, pelvic inflammatory diseases. People with PIDs can have pain below the belly, okay? Lower abdominal pain, they can have that pain. Number two, people with ovarian cysts, okay? If you have an ovarian cyst, you can have that pain. If you have uteritis is the inflammation of the ovary, or of the ovary. So if the ovary is inflamed, you will have uteritis, and that can cause pain. Pharyngitis, many causes there. So anything that is affecting the reproductive system and any of those parts in the pelvic region can cause lower abdominal pain. Issues, even UTIs, okay? Even some people get those lower abdominal pains as a result of UTIs. Another question. Brenda Kabumbeka is saying, good evening, please make a video on bridal ovum. I said that the video on bridal ovum is there live, or it's on my YouTube channel. Check on it. Amina Nakate, hi doctor, I'm so happy. Imagine I have subscribed today. Thanks so much for teaching us. Welcome. Thanks for subscribing. All right, Amina Nakate. Where are you, Amina? Let me know where you are. Takorabi Barbara is saying, but doc, I used to take sugar every day, but I stopped taking it for a month. But when I try to take it, I urinate so much in the night. You see, now there is no problem. You've gotten to know that when you take sugar a lot, you urinate a lot in the night if you take sugar. So just make sure that you either one, stop the sugar, or two, take little. When you're putting sugar in your tea or wherever, take little, right? Take little. Don't take too much sugar. When you take too much sugar, you'll have such complications. Another question. Nuevaze Moses Anthony, doc, please, how do I know that my wife is ovulating? This man is very serious. How do you know that your wife is ovulating? It may be hard to know that your wife is ovulating, though your wife may know, can easily know that she's ovulating. But there are very many signs of ovulation. We said, number one, those women will see that white, that clear mucus fluid, cervical mucus. It's clear, okay? That clear cervical mucus, the women know how to see it. Some of them will put their fingers there and will see the mucus. Or it can even just come on their neck and so on. They can know that this is an ovulation mucus. But the signs may be, which as a man, which you may look at on your woman and say she's ovulating, is that during ovulation, I will say this in, I think it's a secret. During ovulation, women tend to want sex too much. When they enter ovulation, they really feel like they want it. They really want it. It's like a cow on heat. You've seen cows on heat, okay? A cow on heat, a goat on heat. They really feel like they want to have sex. Actually, I don't know, those of you who rear chicken, my friend is called a chicken doctor, Dr. Rogers. He's a veterinary doctor and he specialized in chicken rearing. Dr. Rogers, I think, can be able to explain that. When a hen is on heat, okay, when a hen wants to be made, wants to be made, it just sees the cock. When it sees the cock, it will just go down. It will just go down, and that also can be transcribed, can be translated in humans. In humans, if you happen to say something to this woman who is in her ovulation, on her ovulation day, it's very unlikely that this woman will refuse, except if there are issues between you and her. And that's why you've always heard stories that I never played sex. The first time I played sex, I conceived. The reason is that, remember, when you've not yet had sex, you're still virgin. You try to avoid every man. You fear sex, you don't want everything. But if this man comes on your ovulation day, you also feel like, the hormones, the luteinizing hormone is high. You feel you have a soft body, you're feeling warmth, you feel like you want to have sex. So that is the day a woman is highly on heat. And that is the day still that woman is having around 99% chances of conceiving. So that's, I think, the way you can see that your woman is on heat or is having ovulation. So I'm saying, Assalamu alaikum, Dr. Uthman. Wa alaikum salam wa rahmatullah. Jenny Wambui is saying, hello doc, I had my last periods on September 12th. How many weeks am I pregnant? All right, let's calculate for this one. The weeks she's pregnant. Okay? Because I don't want to just tell you, you need to learn. You need to learn it. So, if you had LNMP, you had your last normal menstrual cycle, LNMP, the last day you saw your periods was on September 12th, on 12th of September, okay? So we shall count for you, 12 September, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. September is 30 days. Okay? So now we come to October 1st, 2nd, 3rd until 31 days. Okay? So after 31 days, today is the 2nd of November. So let's count the number of days. 1, 2, 3, 4, 5, 6, 7. That is week 1. That is week 1. 1, 2, 3, 4, 5, 6, 7, 8, 9, 8. Sorry. 1, 2, 3, 4, 5, 6, 7. Week 2. 1, 2, 3, 4, 5, 6. 7 on first. That is week 3. So, second, let's write, I think, 2nd, 3rd, 4th, 5th, 6th, 7th, 8th, 9th, 10th, 11th, 12th, 13th, 14th, 15th, 16th, 17th, 18th. Which month are we? Okay, 18th, 19th, 20th, 21st, 22nd, 23rd, 24th, 25th, 26th, 27th, 28th, 29th, 30th. October is 31 days. Then today, 1st, 2nd of November. So let's count. We have 1, 2, 3, 4, 5, 6, 7. So this is week 4. 1, 2, 3, 4, 5, 6, 7. Week 5. Week 5. 1, 2, 3, 4, 5, 6, 7. Week 6. Week 6. 1, 2, 3, 4, 5, 6, 7. Week 7. 1, 2, 3, 4. So you have 7 weeks and 4 days. Okay? I think that is very clear now. So you have 7 weeks and 4 days. You are 7 weeks and 4 days pregnant. I think that is very clear with you. So we've captured it for you. Let's go to okay. This one is saying if she's not ovulating, what can I do to induce it? Ovulation can be induced by using medicines that contain luteinizing hormone and sometimes FSH. You can combine, but we use a medicine that contains luteinizing hormone. It can stimulate that. During Tindimweva, can a woman with LH-FSH ratio of 1 to 5 to 1 ovulate normally? You see, when we are looking at ovulation, we don't look at these ratios really, but we shall look at the quantity, what is the level of luteinizing hormone. If it's normal, you can ovulate. The level of follicle-stimulating hormone, if it's normal, you'll ovulate. Leave alone the ratios. Whether the ratios are in whatever form they may be, as long as they are normal levels, you will ovulate. Elizabeth Favor. Elizabeth Favor is saying, Doctor, my cycle length is 27 to 33, but now it can go up to 43. I did a hormonal checkup. Doctor said they are okay. Then what is the cause of irregular menstruation? Now, first of all, that is an abnormal menstrual cycle. Okay? Having 43 days is irregular, is abnormal. What is most likely to cause that is fertility hormonal acid. If you're saying you did all the hormones, if you're saying you did fertility hormones, let me hope that you did all the fertility hormones. There are some people who just go and do one hormone. You're supposed to do all the hormones. There are around 10 fertility hormones. Mainly they are the six, but all of them, there are 10 hormones that can affect fertility. So let me hope that you did all of them. If it is not hormones, then you're likely to be having a fibroid. So check also, do a pelvic ultrasound scan or do any investigation that can make you confirm that you have a fibroid, because those are the main causes of having abnormal periods. Okay. Then we have someone else here is called Timo012 saying, how can I clean my womb? What do you mean by cleaning the womb? What does it have? You want to clean the womb. What does it have? Okay? Some people say they want to clean the wombs when there is nothing. What does it have and how will you clean it? Then Santishos, for 33 days period cycle, when is ovulation day? All right, a person with a 33 days cycle, when is the ovulation? Let's look at it. The ovulation day, please, Maureen and Princess, mute yourselves. I'm going to invite you. Mute yourselves, and then we first listen to other people. Mute yourselves. I'm going to allow you to speak. If you don't mute yourself, then I will just take you off. So this one is saying a 33-day cycle. For a 33-day cycle, we shall say 33 minus 18. Which answer do we get? 33 minus 18. Which answer do we get? Someone give me an answer. 33 minus 18. We are calculating the ovulation day for 33 days cycle. You need to give me answers. 33 minus 18. What do we get? If you don't tell me the answer, I will also not tell you the So, let me check on the answers. This one is saying 15. Another one is saying 15. All right, so it's 15. So 33 minus 18, you get 15. Okay? You get 15. So 15, the person who has asked this question, your Santosh, 15 is the beginning of your fertile days. So get 15 plus 4. What do you get? 15 plus 4. Someone give us an answer here. Someone give us an answer here. Someone give us an answer here. You get 19. People have started. Yes, 19. All right, thank you. So we get 19. 15 plus 4 is 19. I love my guys on YouTube. Thank you so much. There are people who have even put the calculation already. Neki Anthony and Takolabi Barbara, they are already putting the calculation. All right. So 19. Then 19 plus 5. What do you get? 19 plus 5. What do we get? 19 plus 5. 19 plus 5. 19 plus 5. Yes, people are saying 24. So you get 24. Thank you so much. Now, the person who has asked this question, if you are you have a 33-day cycle, your ovulation day is on the 19th day. So if you want to conceive, try this day. 19th day is your ovulation day. But you can still conceive from day 15 up to day 24. All those days you can conceive. Though the days you have very high chances of conceiving, it's on the 19th day. I think you've gotten your answer right away, clear, loud. All right, let's have Maureen. Maureen, what's your question? Be very loud. What's your question? How are you? What's your name? And what's your question? Be fast. Good evening to you, Maureen. How are you? Where are you calling from? You are in the UAE, United Arab Emirates. Yes, what is your question?
Yes. So I want to ask you, because right now I'm So as I'm here in the UAE, what can I use in that I can at least somehow, because I'm not in Uganda, I can't get that treatment, easily.
All right, thank you so much, Maureen. But if you have allergies or sinusitis and so on, if it's just allergies, then you are supposed to take steroid drugs. Drugs like prednisolone, dexamethasone. You can interchange them. You use a steroid and an antihistamine. For example, there is a medicine. It is a common medicine. Most of you know. There is a medicine called cetirizine. So you can combine a cetirizine. You can combine a medicine called cetirizine and prednisolone, or cetirizine with the dexamethasone. But when you're taking dexamethasone, don't take it for more than 70 days. You may develop some other issues. So take a small dose of dexamethasone. Take like 5 milligrams at night, and cetirizine. You can also sometimes, when you have stuffy nose, you can your nose is stuffed, you can have a medicine like loratadine. But use prednisolone or dexamethasone with cetirizine or loratadine. Is that clear? Is the question answered?
Thank you.
Welcome. Thank you so much. Nice time. All right. I think we are switching TikTok off. We are going to YouTube. So whoever has a question, just go straight to YouTube. Look for a channel called Ask Dr. UTHUMAN. That's where we are continuing from, and questions continue. And right away, let me answer this other question on YouTube. This one is saying, you can take it off. So those on TikTok, please bye-bye. Nice time. We are continuing with YouTube. This one is saying, good evening, doctor. Aminat is saying, good evening, doctor. I did a scan, and the scan showed my uterus is bulky with 4.35 centimeters instead of 3.0, the normal size. Could the impression, which is PID and moderate growth of stuff from HVS and MCs caused it? Yes, when you have bacteria, the PIDs and so on, they can cause that, okay? They can cause that, but in most cases, it's when you have retained products. So that can be as a result of endometritis, or even any other PID can cause that. You're talking about the growth of bacteria. Yes, the bacteria can, of course, definitely and also cause that. Michi Love Patty's 5555 is saying, hello doctor. Hello. The doctor said I don't eggs. What do you mean? I don't eggs, and humus is low. What will you use to boost it? Humus. Seriously, what you see when you say you humus, what do you mean by humus? And if the doctor said you don't have eggs. Oh wow. I don't know if I've understood your question, but probably you're saying you have low levels of hormones, and probably your AMH level is low. Usually when your AMH is low, that's when they tell you don't have eggs. Now what you're supposed to do is one, we need to know, I need to first know the level of that hormone exactly, and then you can have some medicines. There are medicines that can facilitate, or they can cause hyper-ovulation, or they can cause follicular development, okay? But that requires you to again do a transvaginal ultrasound scan to also assess that ovary very well, okay? Yeah, if we have the results of the fertility hormonal assay, all the hormones need to be, you need to do all the tests for the hormones, all the hormones, that is the 10 hormones, we need to know their levels, and then we do a transvaginal ultrasound scan, then we look at the eggs, then we can be able to tell you whether we can have at least a follicle developing or not. Then another question. This one saying, Josephine Hembere is saying, thank you, doctor. God bless you. I'm from Zambia. I'm from Zambia. All right, say hi to the Zambians. Amina Nakate, and doctor, me, I have all those signs of ovulation. Am I normal enough? Yes, you are normal. If you have signs of ovulation, even if you have all of them, I stated in one of my videos where I was talking about ovulation, signs of ovulation, I stated 12 signs Were they 12 or 20? Signs of ovulation. So if you have all of them, it's okay, you're normal. And even if you have like 3 or 4, you're still normal. Okay, this one is saying, Jacinta Mbithe is saying, where is 18 coming from? I think it's asking about the formula when we've been calculating the ovulation day. Where is 18 coming from? 18 is a figure in the formula. 18 is a figure in the formula. That is the menstrual formula, and 18 is one of the figures in the menstrual formula. It's like when we are saying the area, the area of a circle is pi r squared. You'll ask him, where is 2, the squared, the pi r 2 coming from? It's if you get that formula, you can do what they call, we used to call it in mathematics, reverse what? Proving the formula. Okay, I think it was proving. Someone remind me, those of you who did mathematics, I'm forgetting, but there is what we used to call, like they give you a formula and then you prove it. You prove how the formula came about, and then you go back to assumptions. After doing the assumptions, then you come up with many formulas there, and then until you come up with the formula. I think you all remember this when they used to give us. Those of you who did mathematics, don't be shame me. There is what they call pi r squared. Area of the circle is pi r squared. So this one has where it comes from, and there is a formula that you can prove this method. There is also, if we say, there is also what they call, I think, there's that formula which was, if I remember, there is this formula which was, I think equals plus or minus b b squared 2ab minus, I don't know whether it's b squared over 2ac. There are some formula which most of you used to call bulldozer. I'm not remembering very well, but that bulldozer formula. So there is where those things come from. After you can derive. They used to say derive the equation. Okay, so that is a menstrual formula, and it can be derived, though I can't, right now we can't go deep into how it came about because it may not be very important to you. What you need to know is use it to calculate your ovulation day. Omoya, hi doc, I texted on WhatsApp, but I got the answer that I should go to your website. Yes, NM Omoya, I don't use WhatsApp because there are very many people who are asking questions on WhatsApp. And if I decide to answer people on WhatsApp, it means I will spend the whole day answering you guys and I will not be working in the hospital. I have to work on my patients. So you book an appointment. When you book an appointment, they can schedule and have the day and have when the time when I'm free, I can speak to you. I usually schedule. Those people know. Those of you who have had consultation with me, they know. You got the website. I think it is there, www.druthman.com. You book an appointment. They schedule. We get time and we have a chat with you, either on a video, text message, or an audio. So we can have it, but not through WhatsApp like that. Luce Mula, okay. Nezima Iman is saying, hi doctor, my cycle is 25 to 26, but in October it started on 30. When is my ovulation day? All right, I'll calculate for you, don't worry. I'll calculate for you. So if your cycle is 25, 26, we shall take the cycle as 25, okay? So be with me. So we shall say 25 minus 18. What do we get? Give me the answer, give me the answer, give me the answer. Especially you as asked. 25 minus 18, what do we get? We want to get we want to look at the day you ovulated. 25 minus 18. 25 minus 18, someone is saying it is 7. Is it? Okay. All right. 25 minus 18, we get 7. Then 7 plus 4 is equal to 11. Hey, I've given you the answer. 7 plus 4 is 11. Then 11 plus 5, what do we get? For the interest of time, we get 16. Therefore, your fertile days begin on the from the 7th. Is darkness. Your fertile days begin from the 7th to the 16th day. Those are the fertile days. From the 7th to the 16th day. Your ovulation is on the 11th day. I think that is clear with you. Who asked the question? It's called, okay, where are you? Oh, it's running. But your answer is clear. The 11th day is your ovulation day. Who else is asking? Let me get, okay. Nezima Iman, I think you've gotten the answer. Your ovulation day is on the 11th day. Lydia Dijamba, can I get pregnant at 44? Yes. Yes. Especially if you're still having your menses, if you're still seeing your menstruation, then that becomes easier. If you're not seeing menses, if you entered amenorrhea or menopause, then we can still induce periods and then you conceive. Luce Mulala, doctor, I want to know why you have 4 and 5 to calculate the ovulation. I told you that is the menstrual formula. Those are the figures. There are figures in the menstrual formula. I think one day I'll come here and that will be the topic of the day, to derive that formula. Where do we get 4? Where do we get the 18? Where do we get the 5? I'll come and we discuss that. But because many people have many serious questions which are significant, I think we shall concentrate on that. Nakafero Sharifa is saying, Doctor, last month I went in my period on 9th, and today I started. When is my safe day? First of all, Sharifa, tell us the length of your menstrual cycle. We need to know the length of your menstrual cycle in order to tell you when your ovulation is. So first tell us the length of your menstrual cycle. Mumunya is saying, I always got my menses on 7th day of each, but shifted to 4th. What is my cycle total days? Come on, you count the days. Okay, you count the days. You start the day you see your periods, that is day 1. 1, 2, 3, 4. A day before you see your periods, that is the length of your menstrual cycle. Do that, you'll get the answer. Okay, Neki Anthony, you're saying, do you have, Doctor, you have skipped so many questions, go back. Yeah, you know, sometimes when I'm scrolling, some questions just pass. But don't mind, if you see your question is skipped, ask again, don't worry. Namai Mukoi is saying, please talk about cervix incompetence and how safe is McDonald's stitch. Thank you so much. Namai Mukoi, an incompetent cervix. An incompetent cervix is one of the main causes of miscarriages, especially in the second trimester. An incompetent cervix is when your cervix either is short or it is too weak to hold onto the product of conception. An incompetent cervix sometimes happen as a result of some women having a D&C, dilatation and curettage, during miscarriage or after miscarriage. Or if your cervix got infected and you got cervicitis. Or some people, it's just natural that they have short cervixes, or their cervix is short, and all their cervix is weak, it has a weak membrane. Now, if you have a cervical incompetence, that doesn't mean that you will not conceive, you only have miscarriages. You can use what they call the McDonald's stitch. McDonald's stitch is when you, the moment you conceive like this, okay? Like we usually do it on the second month or 8 to 12 months, or even just above that. So we stitch, we get a suture, call it a thread, and physically tie the cervix. The cervix is like this, open, like this. Because it's weak, we shall get a suture, call it a needle. We shall get a thread with a needle, the way you tailor your clothes, okay? Using your hands without using the tailoring machine. So we pierce here and pierce here and virtually tie the cervix, close it so that the fetus cannot pass, so that you cannot have a miscarriage. That is a McDonald's stitch. How safe is it? It is safe. It is very safe, because that is the only way we can treat someone who has an incompetent cervix. So it is safe, and that McDonald's stitch is removed during labor. Beatrice Joseph, you're a man and woman, because Beatrice is for women and then Joseph is for men. All right, Beatrice Joseph, you're saying, Dr. UTHUMAN, I have been undergoing on heavy periods of bleeding for almost 2 years. I am 49. I see a gynecologist. They do some procedure in my uterus, but the heavy periods is there. No fibroids. All right, that is likely to, some women when they are approaching menopause, that is called the perimenopause state. When they are approaching menopause, those women tend to have that bleeding. There is also what they call unexplained uterine bleeding, okay? Some people get those bleedings that are not explained in the uterus. Then other times it's as a result of hormonal fluctuations, like we are talking about that you're entering menopause. So some people get hormonal fluctuations or hormonal imbalance and end up with that. Yes, not having fibroids. That having fibroids is one of the factors. Now, what you are supposed to do, I would request that when you go to the hospital, let you do all those tests. Let's first confirm what is causing that. By the way, unexplained uterine bleeding can be as a result of cervical cancer. Can be as a result of cervical cancer. As a result of cervical cancer or endometrial cancer. So try to also do those tests. Screen yourself for cervical cancer. Screen yourself for endometrial cancer. You may be having a cancer running there, and then you're just taking these tablets to reduce bleeding. So check around that area. Jacita Mbithe is saying, hi doc, can one have 28 cycle, another time 35 cycle? Does it change or should be constant? It should normally, the normal, now mark that. The normal, it should be constant. The normal. But so we have what we call irregular periods, and we have what they call regular normal. We have a regular normal period. That is when it is constant. A regular normal period. Regular normal periods. When you have 30 days and there are 30 days every month. But there is what they call irregular periods when they are changing. Now irregular also has regular, or irregular. It also has irregular, normal irregular, and normal irregular. Now, and abnormal irregular. Normal irregular is when you'll have 30, 28, 35, they keep on changing like that. But they are within the normal ranges between 21 and 35 days. But there are those people that will have 15, that is abnormally irregular. 15, 21, 36, 40, that is abnormally irregular. So for you, yours is normal but irregular. Aminat, doctor, please, can cabergoline and bromocriptine also boost egg quality? Because I am currently on medication for high prolactin levels caused by clomid I took. Now, cabergoline doesn't look at the egg quality, okay? Cabergoline only settles the prolactin levels, the levels of prolactin. So it does it for it, but of course it promotes the general good health of your reproductive system, but specifically it is working on prolactin levels. Josephine Hembere is saying, doctor, I used the dope now, but I stopped in 2019. What do you mean by dope? I used the dope, but I stopped in 2019. Until now, I'm not getting pregnant. What can I use to clean my womb? All right. What you are supposed to do, Josephine Dembele, is to go and do a fertility hormonal assay. After doing fertility hormonal assay, I know that it will look at the progesterone, and so it will find that there is a problem with your progesterone levels or any other hormone. You take medicines. When you take medicines, you resume your periods. Then this one is saying, Fahia Muhammad is saying, my period is 27, 29, 26. How can I calculate my ovulation. I think you're meaning ovulation. Now, Fahia Muhammad, use 26 as the length of your menstrual cycle. If you're watching live, if you did put the question and go away, I want you to calculate this for yourself. Get 26 minus 18. What do you get? Write that answer yourself there. Write it there. 26 minus 18. The answer you get on 26, on 26 minus 18, the answer you get add 4. That will be your ovulation day. Nandunga Aisha is saying, Doctor, left fallopian, doctor, I left family planning last year and I have regular periods coming to now 10 months. I have menstrual cycle 2 in a month. Case back. Minutes. Update. So Nandunga Asha is saying, Doctor, I left family planning last year and I have regular periods coming on to now 10 months. I have menstrual cycle in 2 in a month. So what is your question? Nandunga, what is your question? I don't get the question. Amina Nakate, but doc, other people calculate using 17, but I couldn't get them right. But today, I have learned it from your video. Thanks a lot. But doc, your location. My location, Amina Nakate, I am in Masaka. The clinic is called Depo Medical Center. That's where you can get me. Physically, that's where you can find me, Depo Medical Center. And also, if you want to have an online consultation, you go to my website, www.druthman.com. Then we shall talk via online. Okay. We have, another question. Questions are many. Doctor, why do I get wounds after sex yet I'm not dry? Nasa Zikathe, why do you get wounds after sex yet you're not dry? You may be having rough sex. Rough sex can cause wounds, can cause lesions, irritation of the vagina or of the vulva. Then that is number 1. Irritation of the vagina can cause that, and that is as a result of rough sex. Number 2, it can be frequenting sex. Some people have sex every day. Every day. Someone does sex even like 3 times a day and is having it every day for a full week, every day for 2 weeks. That will cause wounds. So that, check around that area. Then also number 3, check around the person you're having sex with. Maybe is having some infection. Maybe is having an STI, and that can cause infections down there, and you'll end up having wounds. We have a few minutes left. I think I'll pick a few questions here. Mutoni Angelique, hey doctor, which food is healthy when you're pregnant? 2 months and 4 months. 2 months and 4 months. Guys, Litras and metformin is working for the 5th time. God is good. Thank you. Mutoni, really, I like the testimony you're giving. I've always told people about metformin, Litrazole and clomiphene. But remember, use it in the right when you have the right cause. Don't you know the problem is that whoever fails to get pregnant, they just want to take Clomid. No, do not just take Clomid. We need to first evaluate what is causing this infertility, and then you take the medicines. So like the way they are working for Mutoni, because probably because her problem is low levels of FSH/LH, and that's why when she takes clomiphene and Litrazole, she conceives, she gets pregnant 5th time. Mutoni, I'm happy for you. Now, foods to take when you are pregnant. Foods to take, we just tell you that take a balanced diet. And what do you mean by balanced diet? A balanced diet, it's when you're taking foods containing, number 1, a protein, foods containing a carbohydrate, foods containing vitamins. Okay? And so now what, and also, now what are you supposed to, which foods are there? Eggs contain proteins. You see, when you're pregnant, it is okay, you can take beans. There is no problem with beans. Beans contain high levels of proteins. They are okay, they are good. Nuts, they are good. Fish is very good when you're pregnant. Even in meat itself, okay? Even in meat. So in other words, when you're pregnant, just eat everything. Make sure that you have a balanced diet. We don't restrict food, okay? But make sure that you take a lot of water, you take a lot of fruits and vegetables. You will be fine. Okay, this one is called Happy Homeware. Happy Homeware. How are you, Doctari? I am not having my period. I am 37 years. Can it be menopause? I really want a child. Yes, it can be early menopause. You can have early menopause, and early menopause can cause that. What are you supposed to do? You know what to do. Go to the hospital. Let us carry out the tests. Let us do tests to identify what is causing this. Then you can get treatment and get a child. There is no reason as to why you shouldn't get a child at 37. If people 50, 54, 60 can get a child, how about you of 37? You can get. But of course, after understanding, after learning your reproductive system, after identifying any problems within your reproductive system, then you can get the medicines and conceive. Nezima Imam. Nezima Imam, thank you so much. All right, welcome. Peter Sikirimo is saying, Doctor, can a person have menstruation while pregnant? If yes, what causes that? Now, as I'm answering this question, guys, do not forget to go to your YouTube and follow a channel called it.next. That it is going to pass there. Check that channel. It's called it.next. It is being operated by my technician here. Mr. Kesbach is a very good IT technician, a very good one. He will help you with all those things of CCTV camera installation, having your website running your social media channels. He's a very, very good guy. So follow Kesbach, put it there. Follow it.next. Check that channel and subscribe. Follow my guy. My guy tries so much to put me live. You guys, it is showing there. it.next. Please, whoever is following me, I'm seeing you guys, all of you on live. Please go to YouTube, check it.next and follow my guy. He's a very good guy. He does for me all these lives. The audio, everything you're seeing here is courtesy of Kesbach from it.next. It is a very good channel doing computer repair, maintenance, photo shoot and video coverage. Yeah, he does video coverages, system software. Those of you with hospitals and you want to run a hospital system, he can do all that. Those of you with hardwares, I'm seeing this one is called Happy Homeware. You may be having a hardware, you have your boutique, you want to run that. Kesbach from it.next can do it for you. Please go to his channel and subscribe. Let's answer this one. Peter Skilimo is saying, Doctor, can a person have menstruation while pregnant? If yes, what causes that? Now, it is nowhere. It is not possible. It is not allowed. It is not allowable. It is not right. It is incorrect to have menstruation while you are pregnant. Some people you can have bleeding during pregnancy. And that bleeding can be as a result of implantational bleeding, especially when you are at your second week on the 14th day. On the 14th day, you can have implantational bleeding, and that is normal. But usually, it is not too much bleeding. So another thing which can cause bleeding during pregnancy is placenta previa, which I've explained sometime here. Also, another condition called abruptio placenta. Or if you're going to have a miscarriage, or if it's what they call threatening miscarriage, threatening abortion. Especially people with low levels of progesterone can have threatening miscarriage or threatening abortion. So now, what you are supposed to do, if you are bleeding while pregnant, you're supposed to go to the hospital. They need to investigate why you are having bleeding during pregnancy. It is not normal. It needs to be investigated and treated. Then, I think we are left with 5 minutes. We are giving you 5 minutes. Omuya, if my total cycle is 28 days, when is my ovulation? A person of a 28-day cycle, we all know. I think this answer I can get it from you, my followers. Please write Someone with a 28-day cycle, what is their ovulation day? I am not going to answer Mr. M.M. Omuya. I need answers from you, those of you following, who have been following me religiously. You must be knowing when is the ovulation day for M.M. Omuya, who has a 28-day cycle. Let me check your answers. Do not be shame me. Please answer this. A 28-day cycle, what is the ovulation day? Aha! Damari Kerubos is giving us the answer, saying 14th day. Is it true? Those of you also following, is the 14th day the ovulation day for a 28-day cycle? Let's get more answers here. I need some other person. I need another answer. What is the ovulation day for the 28-day cycle? I need to know. Numwe Nawembeze Moses Anthony saying 14. Thank you. This one is also saying 14. Now I need one person to give me the answer. One person. One person left. What is the ovulation day for the 28th days cycle person? What is the ovulation day? Those of you who have been following, I need that answer. To this MM, I'm not answering you. It's my followers who are supposed to answer you. Takorabi Barbara is saying 10, 14, and 19. I love that. Takorabi is giving us the answer. So it's showing you, thank you so much. Barbara is showing you that from 10th up to the 19th, you are fertile. You can get pregnant within those days. From the 10th day up to the 19th day, you can get pregnant. But the ovulation day is 14th day, like others have said. So, Demaras, Kerubo, Nuaveza, Moses, Anthony, thank you so much for the answers. It is the 14th day and Takorabi. You guys are in class. Now I'm happy that people understand what I teach. You know, sometimes you may teach and people are not understanding. And they may not tell you that they are not understanding. Okay, so let me have another question. Oh, questions are running away. Questions are running away here. Okay, let me answer this. Oh, questions are running away. Josephine Hembere, doctor, is it good to see period 2 day finish? Can I get pregnant? Yes. It is okay to get periods for 2 days. I said that normal menstruation is between 2 to 7 days. So 2 days is okay, it's good to go. And this will be the last question. Nakafero Sharifa is saying, my cycle keep changing. I answered this. My cycle keep changing. Sometime 25 like this month, and last month I had 28 days. Another question. Doctor, what can I do to get pregnant of twins or triplets? I'm tired of carrying pregnancy, one baby per cycle. All right. So, first of all, changing of your cycle from 28 to 25 is okay. We said that is irregular but normal. Okay, it's irregular but normal. Now, getting triplets or twins, we said we can use medicines that cause hyper-ovulation or hyper-stimulation. And those medicines include what Angelique has been talking about, which is Letrozole and Clomiphene, Tamoxifen of this world, Menapa, and so on. They can be used. Now that will also look at the dosage. How are you going to take these medicines, the dosage, and so on will determine whether you'll be able to get the twins or not. And that is how we do it. And for those of you who would like to have a private chat, a private conversation, go to my website www.druthman.com and book an appointment. I will be right there to answer you. And please become a member of Ask Dr. Uthman YouTube channel. You go to the way you're seeing my channel, there is and join and become a member. You enjoy privileges of sometimes having a one-on-one live chat with me. Do not, if it's your very first time to watch this channel, please do not forget to subscribe and also leave the notification bell in order to be notified of any important video we upload. And I've said, all of you following me today, do not forget to subscribe to a channel called it.next. Go to a channel called it.next. Check it on your YouTube. IT.next and subscribe. He's the man behind my camera. He's the man responsible for everything you're seeing, the good visuals, the good audios. He's called Kesberg, and he works on very many things. He can install for you CCTV cameras. He can repair your computers. He can run for you a social media page. He can run for you a website, everything. Go to the channel. It's called IT.next and subscribe now. Please go there and subscribe. Do not betray me. This is a very good guy of mine, and he does a lot of things for me. Thank you so much. Let's meet in the next live, which will be next Thursday, same time at 19 hours or 7 p.m., 19 hours East African time. Let's meet at that time. Next week, Thursday. For those of you that have not answered the questions, please let's meet next week on Thursday. Time is against me. I sign out. Good night.